Good day, ladies and gentlemen. As I stated that I will upload a video in peripheral vascular disease. You are speaking to the NCLEX nurse mechanic. This is the NCLEX nurse mechanic. And please go to YouTube. There are also other videos as well, especially under live, because most of the classes that we have there under live. So they're a very nice topic. You have your heart disease, for an example, under live. So you can go there. Please watch, please like, please subscribe as well. Okay, so that I don't waste any time, let's start on your peripheral vascular disease. But before I can even start, I just want to make a disclaimer to say that, guys, it's just me, myself, and I am not good in drawing. So I adopted the pictures from Google. I adopted the pictures from Google, right? Talking about peripheral vascular disease, remember, when you talk about peripheral vascular disease, we've got two kinds. We've got your peripheral venous disease, you have your PVD, peripheral venous disease, and you also have your what? Your peripheral artery disease. Before we can even go to the diseases, we need to understand what arteries do. We need to understand what veins do. Remember, when you talk about arteries, the arteries, they carry what? They carry oxygenated blood. The arteries, they carry oxygenated blood, isn't it? Oxygenated blood, I'm just writing O2 there. Where else? The veins, they carry what? Deoxygenated blood. The veins, they carry deoxygenated blood. And again, when you think of the arteries, what do? They take the blood away from the heart. They take oxygenated blood away from the heart. What else? When you think about the veins, they take deoxygenated blood where? Back to the heart. So when we talk about peripheral artery disease, it means that we are not having enough oxygenated blood that is going where? To the peripheries. What else? When we talk about your peripheral venous disease, it means that we are unable to get a deoxygenated blood back to the heart for reoxygenation. I hope we understand so far. Okay, let's explain this further. Before we can even talk about the signs and symptoms, let's first look at the risk factors. Part of the risk factors, you talk about your hypertension, for an example, because you must remember that with hypertension, what happens? The blood vessels, they stretch, and that stretching, it can cause small tears inside the vessels, and those small tears it can occlude the vessels. When it occlude the vessels, you are going to have a decrease in the blood flow. You think of your diabetes, especially when you talk about uncontrolled diabetes, especially in the hyperglycemic state, because remember, too much glucose, what's going to happen to the viscosity of the blood? Is going to become thicker. When the viscosity of the blood becomes thicker, what happens? You are going to have a decrease in the blood flow. It's like, for an example, you have a water pipe, water is running nicely, and then on the water, you decide to add a solute, or let me say you add jelly, isn't it? Do you think that jelly is going to flow as fast as the water? No, it won't. You think of smoking. Over time, smoking, it scars the inner lining of the blood vessels. You think of your hyperlipidemia. Over time, hyperlipidemia, because you think of high fats in the vessels. Those fats, what's going to happen? They're going to stick onto the walls, making the walls very stiff and hard, right? Now, looking at the signs and symptoms, I have a nice mnemonic that I adopted from Nurse Mike. I love Nurse Mike. Love you, Nurse Mike. That I adopted from Nurse Mike. Remember, this is NCLEX. In your NCLEX, you must try make things easy for yourself. You don't study hard here, but you study smart. But then, before we can even talk about the signs and symptoms, as you can see that this side here, it represents what? It represents PAD. Let me just write it for you so that we don't get lost. And then the other side here, it represents what? It represents PVD. Let me just write it for you again, peripheral venous disease, so that we don't get lost, especially when we talk about the signs and symptoms, right? Going back to the peripheral artery disease, signs and symptoms, The A stands for absence of pulses. Absence of pulses. The A stands for absence of pulses. Definitely, you are not going to have any pulses because you are not getting enough oxygen in the peripheries, isn't it? The R stands for round red source. And the sources, you can see them here. They are mostly here on the toes, round red source. Definitely they're going to be round and red because remember that in your peripheral artery disease, your patient does not present with any edema, right? It does not present with any edema because you don't have any blood that is pooling. The T stands for, okay, I did not write the round red source for you. Let me just write round red. You know what it means. And it's writing very far. It's writing very far. Okay. I'll try and bring it closer. Round red sauce, right? You know, round red sauce, right? The T is for toes and feet that are pale or black. It's for toes and feet that are pale or black. As you can see from these toes and feet here, as you can see from these, as you can see from these toes and feet here, isn't it? You can see they are pale or black definitely because you are not having enough oxygenation, isn't it? What I wanted to say again is that you must not confuse neuropathy from a diabetic patient with your peripheral artery disease, because number one, you don't get this round red source. So those are the kind of things that you must look out for, right? And then the S is for sharp calf pain. The S is for sharp calf pain, sharp calf pain. They are definitely going to have the sharp calf pain. They are going to get the sharp calf pain because of they are having oxygenation problems, right? That is why most of our patients who are presenting with your peripheral artery disease, we also advise them they can walk until a point of claudication. It's okay, they can walk until a point of claudication. Remember, when they talk about a point of claudication, it's that point they can walk up until they feel the pain. They can walk up until they feel the pain and then they can rest. Now, going to the signs and symptoms of peripheral venous disease, this is where now we talk about veining. Veiny, the mnemonic veiny, right? The V, which stands for voluptuous pulses. Remember, in your peripheral venous disease, you are not having any oxygenation problems because you are able to get blood into the peripheries, right? But then what's going to happen is that the blood vessels, they're going to be bulging, right? You can feel the pulse. They are bulging, hence the name voluptas, right? The E is for edema. Definitely they are going to have the edema because blood is pooling. Remember, like I stated, that in peripheral venous disease, you have blood is able to go down and oxygenate the peripheries, but then it's unable to go up. Because how is it unable to go up? Other causes, it can be due to your deep vein thrombosis, your DVT. Because if you can look at this picture that is up here, right? Remember, how do we get the blood back up against the gravity? Number one, your calf muscles, the pumping of your calf muscles, they push the blood up. Number two, these blood vessels or the veins, they have valves, right? So because of PVD, you can get it blocking one of the valves. And when it blocks one of the valves, it means that blood will be unable to be pushed up. And then what happens is going to pool in the peripheries. That's why they are presenting with the edema. But the irregular shaped sores, because of the edema as well, right? Their sores, they are going to be irregular, right? Remember, peripheral artery disease, sources are round and red, right? What else? Peripheral venous disease, sources are irregular shaped, isn't it? The N is for no sharp pain. I didn't write the irregular here for you. Let me just write irregular. I've written irregular. The N is for no sharp pain, right? No sharp pain. They are not going to feel any pain. No, oh, look at where it's writing. Okay. I think as long as you hear me, it's okay. The N is for no sharp pain. They are not going to feel any sharp pain because they do not have any oxygenation problems. No sharp pain is going to be felt because they don't have any oxygenation problems. Because remember, in your peripheral artery disease, they are feeling pain because there's not enough oxygen to the peripheries, right? The Y is for yellow and brown ankles. The Y is for yellow and brown ankles. As you can see, these ankles here, I'm sorry, everything is moving. As you can see, these ankles, they're yellow and brown because remember, you must think of the contents that are in the blood, hence, because when the blood is pooling, those contents that are in the blood, your bilirubin, etc., those are the ones that are making the ankles yellow or brown. Those are the ones that are making the ankles yellow or brown. Okay, guys, I think we are going to stop here. Please watch out for more videos. Please subscribe. Please share. Please like. You are definitely going to get more videos. And thank you very much for watching. Please have a good day. And again, please don't forget that, like I stated, that there are other videos as well. You can go watch and like as well. Good luck with your NCLEX exam. This is the NCLEX